Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the Phia Group, empowering plans since 1999. Now here are your hosts, the Phia Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
And Brady.
This is the Phia Group's Empowering Plans podcast, coming to you live from Braintree, Massachusetts. With you today is your host, Ron E. Peck, Senior Vice President and General Counsel with the Phia Group. And next to me, is that barbecue? Is that barbecue I smell?
It is.
Yeehaw! Brady Bizarro. Brady Bizarro, literally fresh from the Logan Airport, where he has experienced numerous flight delays and cancellations on his quest home. It's like the movie Home Alone when his mother's trying to get back to him. You ended up in the back of a box truck with a band led by John Candy playing a bunch of polka music, right?
Love that scene.
Great scene, great movie. Brady Bizarro, back from a conference, a major event where he presented. And today, for your listening pleasure, and this is your opportunity to stop listening. Presumably, you didn't pay anything for this podcast, and therefore it's no harm, no foul if you turn it off. You've been warned. Brady is going to tell us about his experience in Texas. Yes, he was visiting the Texas Association of Benefit Administrators, or TABA. This is not the first time you've spoken at TABA, Brady.
It's not, no.
And they invited you back.
I did something right.
You did something right. Okay. Are you sure it's not that they just like to laugh at the Yankee standing up there?
I don't think that's it. I think they actually like me.
Okay. It's quality and quantity. Well, that's great. Brady, tell us a little bit about what you talked about at TABA this year, how it was received, some of the things that you heard about. Obviously, don't give too much away because people shouldn't be able to listen to this podcast and forego visiting the TABA conference. We want there to be something that's held back only for those members of TABA who visited the event. So it's still exclusive, it's still fantastic, and it's still worth visiting.
I won't give away the whole store then.
All right.
But what I will say is every time I go to Austin, I feel like it becomes more and more like Boston. In fact, I was watching a local news clip where a woman had climbed to the top of a building in protest of some political event. And the subtitle said Boston instead of Austin. So even the people in Austin seemingly can't figure out the difference. But Austin's really a unique part of Texas. First of all, it's the capital. And that's the reason why TABA is often held there, because what TABA is mostly about is an association of benefit administrators in Texas who are mostly concerned with what's happening in Texas and Texas state laws. So they organize a walk on their hill every year. And so they went to the Austin State House. And so a lot of what was discussed at TABA by the other speakers and other sessions involved different developments in the Texas legislature on how to deal with things like surprise medical bills, who knew, or increased drug costs. So really, it's sort of like a microcosm of national issues that we deal with every day at the Phia Group. They're looking at what Texas in particular is doing because it's so big, and whatever it does has ripple effects across the country. But I was sent there because they wanted to hear more in depth about the case that we've covered a couple times now, which was the Texas versus United States case, which was the case that declared the ACA unconstitutional, and the reason that we can all just pack up and go home now because it's all over. So, of course, it's not actually all over, and that case has been appealed. But I wanted to sort of give them a deeper dive into the background of the case, talk about my predictions, which I offered, and we'll see if they come true with respect to how this will turn out in the end. But I think it's important for them to know, because they're in Texas, and I guess we can blame this on them because of that. But if you understand sort of the real background to this case and the legal analysis that was performed by the federal judge, you can see, I think, the future, if you will, of what ACA lawsuits will look like, because the same issues are coming up again and again with respect to the constitutional challenges that the ACA is facing. So that's why I was asked to go. Had a good time. I think the speech was well received. I had a number of questions after my speech. People were asking me about the case, what I thought would happen, but also about different political developments happening in D.C. Medicare for all is on people's minds. 2020 is on everyone's mind as well. So took some questions like that. But it was overall a good time.
That's great. So would you say that, generally speaking, and you just mentioned Medicare for all, you mentioned this case, any other major topics that seem to be sort of immediate concern to the people you were talking to?
A sense I got from a few presentations was that they're looking for, or they care a lot more about provider transparency. That's another topic that we've talked about recently as well. And I know Texas has its own state law that requires, I believe it's hospitals and urgent care centers to post prices on the window on the facility itself so that people can see before they even walk in a generic list. I'm not sure, exactly what that list would say. I don't know how long it would have to be to describe every single service is not possible, but that was on their minds, price transparency with respect to hospital charges and other inpatient procedures. So I think, and also that's really gets at patient education to make patients aware of, what the cost is for some of these procedures. But that was another topic on their minds.
It's interesting you bring that up. Recently, I was visiting Austin as well. And again, it's so funny. The barbecue you can get in the airport food court is better than the best restaurants here. But anyway, I'm going to get off that topic before I get myself too hungry here. And that tuna sandwich is starting to look pretty good. So when I was in Austin, it's funny because I was headed over to my meeting and I'm headed down the interstate. I think I must have seen a half dozen, if not more, quote unquote, urgent care facilities. And, here at the Phia group, between the consulting work that we're doing, some of the advocacy work that we're doing, the issue keeps popping up, according to the people with whom we're speaking, that many of the hospital systems have been buying up real estate and building what appears to be an urgent care, but as in reality, they're pricing the claims using hospital pricing, so it's no better than an ER. So we're spending all this time educating employees and plan members, hey, listen, if you get a bump or a bruise or you're not feeling well, I know you want to be treated. I know you can't get an appointment with a PCP. Go to urgent care instead of the ER. You're going to save yourself and the plan a lot of money, time, and energy. And then they end up saying, okay, I'm going to go to this urgent care just like my employer told me. And meanwhile, what are they doing? They're going to an ER. So it's very sneaky. And so when we talk about pricing transparency, a lot of people bring up the fact that the prices being posted are the charge master prices and nobody actually pays that. So is it really worth anything? My hope is that we can maybe use that to further educate people regarding, those may not be the prices that are being charged, but it may be another indicator whether you're actually going to a real urgent care or an urgent care that's part of a hospital system. It's just so funny. It almost feels like this game of back and forth, right? Where plans are saying, oh, hey, use urgent care instead of the ER. And the hospital saying, oh, yeah, well, then we're going to build some urgent cares. And then we say, oh, yeah, post your prices. And then they say, oh, yeah, we're going to post our prices. So it's so funny, this back and forth. But I think you're right. Texas, to me, feels almost like a petri dish for the country. Yeah. Maybe it's because the variety of politicians and their willingness to just, try different things, or the fact that the hospital systems in Texas are, maybe begrudgingly, you want to say it, but they're pretty tough. The number of lawsuits where I see Baylor as an example listed as a plaintiff in the lawsuit, they're willing to take action. And then on the flip side, the employers are willing to get their hands dirty. They're more involved in their plan, in their benefit plans, and their employees' health. Third-party administrators and the vendors and the advisors and the brokers and consultants in Texas, likewise, are willing to try different things and get their hands dirty, which is why I think Texas in a lot of ways is like a petri dish for our industry. It is one of the capitals of self-funding, I would say. As far as our clients, certainly a huge amount of our business comes from Texas, and we're grateful for it. I think TABA, in a lot of ways, then, is like a petri dish as far as industry association is concerned. And that's why I'm just so curious to hear from you, what issues were important to them, but also some of the innovative ideas that they were willing to share, and some of the thoughts that people had that I don't know if there's anything that you can actually share without violating the trust the cone of silence, but maybe something you left the event thinking that you weren't thinking about before.
So Ron, one of the things that I noticed was talked about a lot at this conference, and I had some private discussions after, was these cost containment programs that involve employee engagement. And we know from our work here at the Phia Group, when we work with our partners and other vendors, that oftentimes for employers, it's an uncomfortable conversation to have with their employees when you're saying things like, get engaged, read your bill, look for errors on your own, come talk to HR before you have a procedure. It's not always easy to approach employees and get them to be mindful of the cost of care, to get them incentivized to care. And also these programs that you can come up with as an employer are not easy to administer. But in Texas, though, there's more of a sense that there's more free flow, I would say, discussion between employers and employees. And those employers are more willing to take risks and to take chances with certain cost containment programs and incentive programs. And so I think probably because of the way Texas is, it's a very much a, keep government out of things kind of state. It's a very fertile ground for ideas where employers are taking charge of their own plan and not relying on others to do it for them, I think what you see is a more willingness to have these discussions with employees. And frankly, as it relates to threats to the ACA and what that may mean for employees, employees who are concerned about not having coverage for essential health benefits or not having the ability to stay on their parents' plans if they're under age 26, or those employees who may have a serious underlying condition and they're afraid they may lose coverage. Those employers in Texas will have those discussions with their employees and say, look, here are what the threats are to the Affordable Care Act as an example. Here's what they're considering to do to change, to protect them going forward. And I saw my role as sort of explaining to them more in detail about what this case stood to do in terms of how it could undermine the ACA and, in fact, how it could lead to the ACA's end. So I think maybe it's just prudent to talk a little bit about some of the things I brought up at the conference that I thought was worth watching as we move forward. And one of those things is the question about what happens if the individual mandate, as it is now, has been declared unconstitutional. If that's the finding of a higher court, what happens to the Affordable Care Act? My own opinion here is this case in Texas is a quick refresher for those who may have not read it or didn't tune into another material we put out on this case, is that a Texas federal judge concluded that the ACA's individual mandate is unconstitutional because of congressional action taken 2 years ago now, which removed the penalty associated with it. So the thinking is, how can you have a mandate to buy health insurance which was relying on a penalty that people paid if they didn't follow the mandate? Now that penalty's been zeroed out, how can you have that mandate stand? And the judge in Texas said that, well, you can't. It's so important to the ACA. It's so essential, the individual mandate, because it offset things like the freeloading problem or the problem of how do you underwrite risk for sicker individuals. The mandate was so important in balancing out costs in the entire system that if you struck it down, the rest of the law had to fall. And that was the opinion of this Texas judge, which has since been appealed. And so my thoughts, and I said this to the crowd at TABA, is that I think if you look at that legal analysis on its face, it's pretty sound in the sense that the original challenge to the ACA concluded that the individual mandate itself could only be upheld as a taxing power of Congress. So the other constitutional mechanisms, one being the Commerce Clause, was not available to Congress to use. So they had to rely on the taxing power. Now that you have no penalty, you're not raising any tax revenue, right? So it's not fairly construed as a tax. So you've lost the constitutional framework to uphold the mandate. And if the mandate falls, the judge in Texas here took the next step of saying the whole law has to fall. And that's where I explained to the crowd, and I think this is still the case, that that's a bridge too far. And that's a lot of the feedback from on this case and the criticisms of this judge stem from the fact that many legal scholars on both sides of the aisle, all across the political spectrum, really think he went too far in striking down the whole ACA. And in fact, he did some things after he issued this opinion which undercut his own argument. Namely, he stayed his own ruling. He said, look, I'll put this ruling on ice while it's appealed, which is not something you do if you really feel strongly about your position. And he also neglected to issue a nationwide injunction. So typically when federal judges declare a law unconstitutional, if they feel strongly enough about it, they'll block its implementation nationwide. They have the authority to do that. And in this case, this judge could have done that. He chose not to do that. And so because of that, I think the case as it stands now at the next level at the Fifth Circuit Court of Appeals, I think those judges, the panel of judges that will review this case, will look at those actions and probably take them into account when they make their own ruling on this case. But I think it's important that it started in Texas. Apparently this particular judge was notable for having made similar rulings on certain legislation that was passed under the Obama administration. And so probably not by mistake that this case started out in Texas. It's now in the Fifth Circuit, which is not in Texas. It's in New Orleans, Louisiana. But I think this sort of Texas stamp that it has on it will follow this case all the way potentially up to the Supreme Court, which I think is where it could eventually end up.
So speaking of the Supreme Court, I don't want to necessarily call it the original, but the first Supreme Court decision regarding the constitutionality of the ACA that I can remember, you referenced it before, they had determined that it was constitutional because it was a tax. And the big challenge at the time was that you can't force people to engage in private commerce, right? And so they basically said, well, they're not forcing them to engage in private commerce. It's a tax, meaning the penalty. Everybody's going to pay a penalty, but if you purchase insurance, we'll waive the tax. So basically, they're not forcing you to purchase insurance. The purchase of insurance is a voluntary decision you make to avoid the tax, but everyone starts off at the same level being taxed. If indeed now that tax, quote unquote, individual mandate has been removed, what's the next step? I mean, could someone potentially then, in essence, file the same type of lawsuit, the same challenge that was filed back then again? Because now that defense that it is a tax has been removed. So basically, this decision in and of itself is not enough to have the law itself invalidated, but does it give somebody an opportunity to refile the same challenge that was filed almost a decade ago?
Yeah, I think that's probably what's likely to happen. I think for those who agree with this Texas judge that not only is the mandate unconstitutional, but that it's so essential that it's inseparable from the rest of the ACA, that the whole law must fall. I think those that agree with this judge, if in fact a ruling comes out that goes the other way, those same people will refile the case and say, okay, look, we get that the mandate's been declared unconstitutional. Now we're going to make that second argument. We're going to say then, how can the rest of the ACA stand? And they're going to lay out all the reasons why the house of cards should just collapse. I think that's likely to happen. And in fact, if you read the opinion that this judge issued here, 55 pages worth of it, much of it is devoted to making the case for how essential the mandate was to the ACA, because literally everything the ACA was designed to do, which was to reduce costs for everyone generally, to provide guaranteed issue insurance to those who had conditions that were expensive to treat and maintain, to provide for the community rating provision, which says that insurance companies can't rate people differently with few exceptions in a certain geographic area, and of course the Medicaid expansion, which was struck down. All those things were counterbalanced by this mandate, that people who are healthy, like us, generally speaking, who pay into the system would offset the costs of expanding care for everyone else, for all the people I just mentioned. And if you remove that from the equation, from the puzzle, then really the whole thing does kind of collapse, right? It's also why, and if I were the plaintiffs in this case, I'd point to certain states, which have, like Massachusetts, which have implemented their own mandates at the state level, because they recognize that you need to have, as any insurer would, have someone in your risk pool who's not using your product, right? That's sort of common sense insurance 101. So it's the same with health insurance, and I think that this case, even if it's decided in part in favor of the defendants and the ACA is upheld, you'll probably see another version refiled.
The money's got to come from somewhere, Brady.
It does, yeah. Not for me, though.
You're already contributing. Thanks.
I pay enough.
There you go. He's paid his dues. Speaking of paying your dues, you had a hard time getting home.
Well, yeah, sometimes it happens where, the snow comes in just at the worst time when you're trying to land an airplane. But thankfully, I got here in one piece. So, the things I do for the Phia group.
And Taba, we appreciate you both.
And Taba.
So on behalf of myself, the Phia group, Brady, Bizarro, the man, the myth, the legend, and of course, speaking of legends, the one, the only, Pat the Man Santos, the greatest podcast producer in the world. I challenge anybody to say otherwise. This is the Phia Group's Empowering Plans podcast. We thank you for your time and attention. Have a good one.